54 out of your Lewis text, Nursing Management of the Female Reproductive Problems. So infertility. This is the inability to conceive after 1 year of unprotected sexual intercourse. There's many different causes. It can be from ovulation problems, endometriosis, tubal dysfunction, problems with the cervix, obesity. So diagnosis, they'll do ovulatory studies, and this is where the woman will take her basal body temperature and record the temperature, and then they can determine whether ovulation has occurred. Because when ovulation occurs, the progesterone is going to be high, so therefore the body temperature is going to be high. Here's just an example of how they can tell when ovulation occurs. So some other diagnostic studies, they can do a tubal patency test where they inject dye into the fallopian tubes and uterus, and they do kind of a visual study of it. They could do a postcoital study, and that is a study of the cervical mucus. So they just see if the environment of the cervix is optimal for sperm to survive and successfully penetrate an egg. So your role in infertility. So whatever the cause is, you're going to want to help manage that. You want to give the couple emotional support. It has to be frustrating after trying for a year or even more. Abortion. It can be spontaneous, and this is when there's a natural loss, or it can be induced, and this is where it's intentional or elective. So problems relating to menstruation. It's normal for women to be irregular during their first few years after the onset of menses, and it's normal for a few years before menopause for things to be irregular again. Premenstrual syndrome. They're really not sure of the cause. They think that it could be maybe genetics, hormones, neurotransmitters, maybe a mix of all of them. So some of the clinical manifestations that you'll see will be bloating, cramping, edema, binge eating. This is why us women love to eat chocolate and junk food right before we get our period. So, kind of some drug therapy. They might, ibuprofen is used a lot of times because of the cramping and the bloating. Ibuprofen will help with the pain. They can give diuretics for any fluid retention, vitamin B6. And sometimes some women get anxious around the time of their cycle, and so they can control it with medications like Buspar, Prozac. They could do calcium, magnesium, and sometimes that helps with the anxiety. And then to control all the symptoms, they might give like an oral birth control. So some non-pharmacological ways to help the PMS is to avoid caffeine, eat healthy, which most people don't binge on healthy food. It's usually junk food. And then promote exercise. And exercise is going to release that serotonin, that happy neurotransmitter. So dysmenorrhea. So this is like a painful menstruation. So the woman's going to have a lot of abdominal cramping and pain. So to control this, NSAIDs like ibuprofen, Advil are effective, again, promoting that exercise and healthy eating. Types of vaginal bleeding. So There is several different types. There is oligomenorrhea and secondary amenorrhea, menorrhagia and metarrhagia. Oligomenorrhea, this is when there is like long intervals between their menses. So their menses aren't regular, not that 28 days in between. The menorrhagia, that's where there's excessive bleeding, usually more than 7 days. So the woman's going to keep bleeding, and so really you're going to want to monitor for anemia. So checking that CBC to make sure that the woman's not losing too much blood. And metarrhagia is where there is just some spotting, and again, all of them are irregular. So to control it, they'll use oral contraceptives, and that will help get the woman more on a regular cycle, and kind of help with some, if there's any side effects that go along, like some of the heavy cramping can be alleviated by oral contraceptives. So they could do surgical therapy, and that would be like they could do a D&C. They can do, and usually that's for, they do it for the excessive bleeding and the spotting. They can do the balloon thermotherapy, and that's when they put a balloon into the uterus, and then they inject it full of fluid, and then that kind of, what it does is the fluid that's in the balloon is really hot, and so it causes ablation of the uterus lining, and then the uterine lining just kind of comes off, and usually that happens in about 7 days or so. They can do a hysterectomy, but again, kind of with that uterine balloon thermotherapy and the hysterectomy, for women that want children, they should not get these procedures done. So, nursing management, your job, you want to always ask the patient how heavy the flow is, because to them they might feel like they're bleeding, but bleeding quite a bit, when in reality they may not be bleeding as much as they think they are. You want to find out how often they have to change their pads. Like if they're telling you they're having to change the pads several times within a couple hours, then really you need to find out more, about their flow, because they, like I said, they have a risk of losing too much blood and developing anemia. Find out when their last menstrual period was. You want to teach about tampon safety, because women that wear tampons are at risk for developing toxic shock syndrome. So ectopic pregnancy, we talked a little bit about this in the last unit. So it's basically where there's a tubal pregnancy. Women will have a lot of pain, some spotting, cramping, and a lot of times the pain is unilateral on the side wherever the trophoblastic tissue is implanted. So what they'll do is they will do diagnostic studies. They'll take the HCG level, and then they'll do like a transvaginal ultrasound. So nursing interventions, what are you going to do for this patient? You have to monitor their vital signs every 15 to 30 minutes, because this patient is at risk for hemorrhage and rupture of their fallopian tube. And so those vital signs are so important, and as well as watching for shoulder pain, because that shoulder pain can indicate that fallopian tube ruptured, and what happens is that pain is referred to the shoulder. And you want to make sure that you're explaining what's going on. They can treat it with methotrexate, and that's if the mass is 3 centimeters or smaller. But and that's going to destroy that, it's going to stop the growth of the trophoblastic tissue and destroy it. But if it's greater than 3 centimeters, they'll have to do surgery. So perimenopause and postmenopause. So postmenopause is life after menopause. Menopause is defined as going a year without having your menses. So some of the signs and symptoms, the women are going to complain of hot flashes. So if you see a woman stripping, most likely it's because they're experiencing hot flashes. They'll have weight gain, sometimes some pain, irregular menses. So collaborative care. So drug therapy, they can do hormone replacement therapy. So like Prempro or Premarin cream are some examples of drug therapy or hormone replacement therapy. But so some of the side effects that the woman could experience with this therapy is some spotting. And the great thing about hormone replacement therapy is it reduces the risk of osteoporosis, but it also increases the risk for heart disease, breast cancer, DVT. So really tell the patient they need to be getting those mammograms, monitor when they come in, monitor their blood pressure, pulse, encourage a healthy lifestyle with exercise and healthy eating, and then teach them the signs and symptoms of DVT. Some non-hormonal therapy. So this would be like keeping the room cool, having the patient dress in layers for those hot flashes. The patient will want to decrease caffeine, maybe take a vitamin E supplement. Soy products and black cohosh have been found effective to help with some of those side effects. And then exercise and healthy diet and calcium and vitamin D. So just be aware that different cultures and people have different ethnic backgrounds and values. Kind of see menopause as different, differently from other cultures. So just being culturally competent and figuring out how to treat your patient. So for perimenopause and postmenopause, so again, postmenopause, you want to teach how the woman can control anxiety because they're going through some major hormonal changes. And sometimes having sex is really hard because like the vagina will be really dry. So a little KY jelly can solve that. So conditions of the vulva, vagina, and cervix. So these can be like yeast infections, STDs like herpes, and those are going to be like painful lesions. Genital warts, those will be like little cauliflower shape. Usually those are painless. And then like infections like bacterial vaginosis. So the clinical manifestations are going to depend on the infection, like with candidiasis or yeast infection, the woman will get like kind of that thick white cottage cheesy discharge, and bacterial vaginosis can be they'll have like discharge that can be like a white or yellow, but it's not like odorous. So diagnosis, again, depending on whatever infection they have or condition, they can do a wet mount, and that will help with diagnose yeast infections or bacterial vaginosis. Usually like herpes and warts, they'll do based on clinical appearance and the symptoms. So treatment, they can use antibiotics. If it's an STD, the partner needs to be evaluated. Yeast infections, they can use like clotrimazole cream, diflucan. Pelvic inflammatory disease. This is an infection of the pelvic cavity. A lot of times, women don't have symptoms, but as it progresses, they'll have some pain. It can be caused from STD, surgery, abortion, childbirth. So again, as it progresses, the woman will have some pain, might have fever. The complications from PID, they could develop septic shock or a condition called Fitzhugh-Curtis syndrome, and this is where the infection will spread to their liver. So it's going to cause a perihepatitis. And what's going to happen is they're going to complain of a lot of right upper quadrant pain, but their liver function tests are going to be normal. So collaborative care, no sex for 3 weeks. They need to be put on antibiotics. IV antibiotics. They'll have to be put on bed rest and get fluids. They may get some corticosteroids, heat. Some analgesics for the pain. So nursing management, what you can do, really encourage the fluids. You'll want to do their vital signs, look at any discharge they're having, like vaginal discharge. You want to keep the head of the bed up at least 30 degrees because you want that pelvic cavity to drain all that fluid and junk out. And when you put the head of the bed up and that pelvic cavity can drain, it's going to prevent any further abscess. So endometriosis, kind of a interesting phenomenon. This is where endometrial tissue will spread to other parts of the bodies, and it's like wherever it spreads to has just like a menstrual cycle. That lining sheds, and it can go anywhere in the body. I even read a story about a woman who had it up kind of by her hip, and it caused like debilitating leg pain. So clinical manifestations, again, pain, irregular bleeding, backache, dysuria, wherever it's at, it will be painful. So collaborative care, so drug therapy, they'll give like ibuprofen for the pain, diclofenac, Lupron, the Depo. If they have to do surgical therapy, they're going to remove the endometrial tissue from wherever it goes to. But you want to make sure that you are controlling the pain and controlling their anxiety. So, tumors, benign tumors. So, leiomyomas, these are uterine fibroids. So some of the symptoms, a lot of times the women are asymptomatic, but if they do have symptoms, it could be pain, pressure, increased bleeding. So treatment for this, when they have the heavy bleeding or they become anemic, they have to do surgery. So there's a few different surgical procedures they can do. So they can do a hysterectomy. They can do cryosurgery. But with the cryosurgery, they can have bone loss. So, and for the women that, still want to have children or have that chance at having children, then they need to make sure that they don't do the hysterectomy or the cryosurgery. They can do a uterine artery embolization, and this is safe that just removes those little uterine fibroids, and that's safe for women who want to have children. Again, post-op care, like other surgeries, you really want to make sure that you're teaching early ambulation, like exercises, like moving your legs around while you're in bed, to prevent any blood clots. Cervical polyps. These are little lesions on the cervix. They're usually benign, but they can become malignant. Usually they don't show symptoms of it, other than sometimes they can have a little bit of bleeding after a bowel movement. But with cervical polyps, it puts the woman at a higher risk for infection. So what they'll do is they'll remove the polyps by doing a procedure called a polypectomy, and they're just going to examine those tissues to make sure that they're benign. So polycystic ovarian syndrome. So these are benign cysts that form in the ovaries. So the symptoms are going to be like irregular menstrual periods. It can cause the woman to become infertile. And when these cysts rupture, they're very painful. And the woman will get a lot of pain in her perineum area. Diagnosis is through ultrasound. And what they can do for this, for treatment, is medications. Clomid is a fertility medication, and it induces ovulation. So if a woman wants to get pregnant, that would be the medication to use. They can use like oral birth control to regulate the menstrual cycle. And you're going to want to teach the patient to monitor their weight, because obesity makes the problem worse. You're going to want to monitor their lipids and glucose level. So cancer. So cervical cancer, this is cancer of the cervix. A lot of women at first are asymptomatic, but eventually what will happen is they'll have like a thin, watery white discharge, and eventually the discharge becomes dark and really odorous. They'll have a lot of pain, weight loss, anemia. Diagnosis is through Pap, a Pap smear. But if a woman has an abnormal Pap smear, then they need follow-up. Don't don't assume right away that something's wrong. They'll have to have the test followed up in 4 to 6 months and have to have it done for 2 years. And then if they have more of a prominent change, then they'll need to do like a punch biopsy or a colposcopy. So collaborative care, it's really important to promote like the Gardasil vaccine, and this is a vaccine that protects against different strands of HPV. And the reason why this is important is because they have found a relationship between HPV and cervical cancer. So other treatments they can do, it's going to depend on the stage and age and health of the patient. They can do conization, and if the woman's in like stage 1, this is where that's appropriate because it helps both diagnose and take out the cancer. Once the stages progress, like if it goes beyond stage 0 to stage 1, they'll do like radiation therapy or hysterectomy, and then stage 2 they'll add chemotherapy. And you know, usually by the time they get to stage 3 and stage 4, you know, it's not so good. Endometrial cancer, it's a cancer of the endometrium. The clinical manifestations are going to be abnormal bleeding, and usually this is in postmenopausal women. So collaborative care, hysterectomy, they can do progesterone hormonal therapy. That would be like, an example would be Megace is usually the treatment. They might do tamoxifen with the progesterone therapy, or just a regular chemotherapy agent. So ovarian cancer. So they haven't really pinpointed a cause for this, but we have the BRCA genes. All of us do, and what that gene does is it inhibits tumor growth. And there is a theory that says that people who have this gene mutated usually are the people that get cancer. So clinical manifestations. Some of the early symptoms are pain, bloating. They might have difficulty eating, urinary frequency. Sounds like pregnancy. But some of the later symptoms, they might have menstrual irregularities, and then they ironically might have weight gain or weight loss. So diagnostic studies, they can do an abdominal ultrasound. If they do find a mass, they'll do what they call the OVA1 test, and that just sees if the mass is malignant or benign. So they'll stage the cancer, and it's very similar to the other cancers. So stage 1 is the best prognosis. They can do hysterectomy, chemotherapy. By the time stage 2 rolls around, they'll add radiation to the chemotherapy. If it's stage 3 or stage 4, really their prognosis is not good. So by that point, comforting them, helping them manage their anxiety is really important. Vaginal cancer is rare. And it's cancer of the vagina. Treatment is surgery to remove the cancer, and they'll do radiation. Vulvar cancer, again, this is rare as well, cancer of the vulva. Symptoms would be like itching, burning, bleeding. We'll diagnose it by biopsy. And the treatment is a radical vulvectomy. So the different surgical procedures. So external radiation therapy, this is where they use like the electromagnetic radiation waves. With this kind of therapy, it's important that we don't, like visitors can't stay past 30 minutes with the patient at a time because they're exposed to some of that radiation as well. Brachytherapy, this is where they have radiation right near in the tumor. So nursing management of these cancers. You want to assess the bowel bladder pattern, look for any vaginal discharge, look at their signs and symptoms that they're having, some diagnoses, anxiety, pain, grieving, disturbed body image. And we really want to control their pain, give them comfort, and help them maintain their independence. So health promotion, early screening is the key. Some interventions related to surgery. So with the hysterectomy, again, so after surgery, they're going to have a dressing on, so you're going to want to watch for bleeding. There should be some drainage, but it should be serosanguinous. They're going to need to have a Foley catheter for 1 to 2 days. So monitor their urine output. If they have low urine output or back pain, that needs to be reported to the surgeon right away, because that could mean that the surgeon accidentally did a ligation of the ureter. You're going to want to listen for vowel sounds to make sure that the patient doesn't develop a paralytic ileus. You're going to want to prevent DVT, so early ambulation, doing little leg exercises in bed, like SCDs. A vulvectomy, they're going to have some sort of drain, so watch for the drainage amount. They're going to need to have an indwelling catheter in, need to be on anticoagulants, so watch for bleeding or symptoms of DVT. Watch again for any vaginal discharge. They're going to need to be on stool softeners. So, nursing implementation. So with the acute intervention with radiation therapy, again, I talked about don't stay with the patient for more than 30 minutes because you want to lessen that radiation exposure. You're going to want to stay 6 feet away from the bed. If the patient has like a radiation implant, making sure that they stay on bed rest because you don't want that implant to fall out. So problems with pelvic support. This would be like uterine prolapse or the Cystocele and Rectocele. And the Cystocele is where the vagina and bladder becomes weak. And then the Rectocele is where they'll have the vagina and rectum. So they can have like a rectal or vaginal prolapse. So to treat that, they can do surgery. Kegel exercises are really helpful. They might have to do a procedure called an anterior posterior colposcopy. And with that, so then post-op teaching, you have to teach the patient how to perform catheter care 1 to 2 times a day, ice packs. You want to prevent constipation, tell the patient to avoid heavy lifting when they go home. A fistula is any opening between an internal organs or from an internal organ to the outside of the body, but the openings are abnormal openings, that they shouldn't be there. So how they manage fistulas usually is surgery, because depending on where the opening is, it can cause infection. So if you have an opening, if you have a fistula between like your vagina and rectum, that is breeding ground for infection. So you really want to make sure, so if the patient has this kind of fistula, that you're promoting really good hygiene. They'll have to have the catheter, so catheter care, that you're pushing fluids. So sexual assault, it can be physical or psychological. And physical is the most common. And it's really sad because a lot of times these women blame themselves. And, oftentimes they'll go, if it's a spousal type of thing, they'll go back to their spouse. But it can be from somebody they know, like their spouse, or a complete stranger. This includes like any rape, like oral sex. So there is a, usually ERs have a designated RN who does the examination, and they've had SANE training, and this training is really important because it teaches the nurse how to examine the patient but preserve the evidence. So really, it's really important when you're doing your assessment, like if the patient physically has been abused, like if they have facial or skull trauma, you want to make sure that you are checking their neuros. You want to check the bleeding, check for vaginal trauma. And after the examination has been all done, and you'll want to verify that they're completely done, you're going to want to help the woman change her clothes, because the clothes are going to be evidence most likely, and the woman's not going to want to wear that home. She's going to feel dirty. She might feel ashamed. So after the exam, she can shower, brush her teeth, use some mouthwash, especially if she's been forced into oral sex. And then make sure that you offer the morning after pill, because there would be nothing worse than being raped and then getting pregnant from it. And so make sure that you offer that pill. And then just providing that emotional support. You may want to do like a referral to a counselor, because that's such a traumatic event. Make sure that, when you do send her home, that, maybe she can have a family member or a friend, somebody that can offer her support, be with her, because again, it's traumatic, and some women even experience like post-traumatic stress disorder. So those referrals are very important.